You're tuning into the Active Mom Podcast with physical therapist, Dr. Carrie Pagliano, a real mom's guide to all things postpartum return to workouts after baby. If you're a postpartum mom, coach, trainer, or physical therapist looking for answers on how to get back to running, CrossFit, yoga, Pilates, HIIT, you name it, without the fear of pelvic floor issues or doing something wrong, this is the podcast for you. Let's start the show. All right, so pulled up the coolest paper the other day looking at the difference between running biomechanics during and after pregnancy. And I love this for so many reasons. One, because no one's really looked at this yet. And I love seeing more research about pregnant women. So I reached out and researcher Jenny Bagwell agreed to come on. So thank you for coming on the Active Mom Postpartum Podcast.
Yeah, thank you for having me.
So tell us a little bit about who you are, where you're from, and what you do.
Okay, yeah. So I am originally from Nebraska and went to physical therapy school at Duke, worked in outpatient orthopedics for about 3 years, and then was really fascinated by biomechanics. So I got into this research now through orthopedic biomechanics, was studying femoroacetabular impingement syndrome, and looking at movement factors maybe related to that. And then I got pregnant with my oldest, and my advisor at the time, Chris Powers, was like, we should look at this, like see what's known about Gait. You know, of course it becomes a research project. And then the more I looked into it, I was like, oh my gosh, there's so much we don't know about pregnancy and postpartum, and especially related to movement and biomechanics. Whereas like, you know, ACL injuries, all these other topics, we have so much biomechanics research, but this very common thing we know so little about. And then from a biomechanics standpoint, it's completely, pregnancy is fascinating. So it was kind of became this, you know, overlap between what I was really interested in, my skill set, and where I felt like there was a real need. Mm-hmm. And so after my PhD, I worked at Creighton University for a few years, and now I'm at Cal State Long Beach, and I've been looking at pregnancy and postpartum biomechanics and muscle function for about the last 10 years now. And just such a super fascinating area, and still so much more that we need to know.
Definitely. Yeah, no, I always think it's interesting when, especially PTs, we do this, where all of a sudden we get interested in something because we're going through it. So for you, thank you, Chris Powers, for inspiring that. You know, were you kind of like trying to go through some self-analysis going through it? Like what was kind of your first foray into trying to understand biomechanics? Because you're like, all right, I feel different, but how do we navigate this?
Yeah, totally. So we decided, you know, every month I'm going to come into the lab and we're just going to look at my Gait biomechanics and see if anything changes. And I really didn't know much when we started about the other literature in this area. And with my first child, it was actually super smooth, you know, felt normal, didn't have any pain, etc. But we did see some differences in my biomechanics. But with biomechanics research, you know, one person, it's hard to draw any conclusions. And so then the more I started looking into it, I was like, there's so many other changes, so many pathologies, conditions, pains that people have, but we really don't understand if possibly movement is related to those factors or could contribute to those factors. So then we submitted a grant to the Academy of Orthopedic Physical Therapy and got funding for the project that I did when I was at Creighton. And I got pregnant with my second child during that project and had a totally different experience and had, you know, pelvic girdle pain that was pretty significant. And so then it was fascinating to me because now I felt like I kind of identify with all different presentations during
Yes.
pregnancy and how that might relate to movement.
Right. Well, and I mean, I think you could hit on a couple of things. One is every pregnancy is different. Just because you had one way doesn't necessarily mean that it's going to be the same for subsequent ones. But those first studies, was that mostly looking at just walking? Was that where you started?
Yeah.
Okay.
So with me, I just looked at walking. I actually looked at walking, and then I also looked a little bit postpartum with baby carriers, which there's some super fascinating research now in baby wearing and baby wearing biomechanics, which is all of that's very interesting too. And then when I went to Creighton, we started looking at walking and overground running, which is what this paper that I just published was from. And we looked at balance. So single leg stance with eyes open and eyes closed.
Yeah. I think it's such a good reflection too of kind of just where our attention's been in pregnancy and postpartum. And your kids, you said, are 10 and 6.
Yeah. 10 and 6. Yep.
Yeah. So, 10 years ago, we weren't focused on, and we had no data on women running, period. Like, it was just,
Totally.
okay, maybe run in pregnancy, maybe not. And then, our clearance was, all right, 6 weeks, you're good to go see what happens. Like, we didn't have guidance. And even 6 years ago, we didn't have guidance. So I think it was, for you to kind of have the foresight to be like, all right, hey, we need to pay attention to this because it's so relevant now that we have a lot more papers just saying, hey, we've got women doing this. We need to understand this a lot better than what we've been doing, which has been nothing.
Which is amazing to see some actual guidance and information for how to do this and how to do it safely.
Yeah. No, there's so many moms that I talk to because I'm seeing them now in like perimenopause and menopause. And they're saying, well, I didn't know that then. I'm like, well, we didn't either. You didn't know it because we didn't know it.
Yeah. Even try asking an IRB for permission to let pregnant, I had to go before the full board and talk about, is this safe? And
so what does an argument like that look like? So the average person doesn't understand A, what an IRB is, and then B, you kind of have to ask for ethical permission. And nobody's going to want to do the study or this says, hey, if I do this, it's going to kill your baby. Like no one's going to do that study.
Yes.
So knowing that obviously women run in pregnancy, how did that pitch go to IRB?
Yeah. So our kind of compromise was we would receive permission. We would tell their obstetrician or midwife exactly what the study entailed. We would let them decide if they were going to participate in the whole study or if they were not going to run. And so there were a couple participants that the obstetricians said, I'd rather they not run.
These were runners already. And
so they are not necessarily runners. So we are just recruiting all takers, which is an important, I think, consideration with our results too. So some of these people are trained runners, some people are not.
Gotcha.
But even then, most obstetricians or midwives actually were fine with them participating. But we did have one or two that said, I'd rather they not, even though it was overground running for 15 meters. It's not like
right. It's not a marathon.
Yes.
Really? Did you have an opportunity to ask them why, or it was just a no and that was it?
For most of them, I didn't get like a detailed conversation. I think it's just they don't want to be held liable should anything happen, right? That issue.
Right. In that 15 meters. Who knows what's going to happen? All right. So how did you set up the study?
Yeah. So we're actually looking at running now and looking at it a little differently, but for this previous study, everyone came during second trimester. They came again third trimester and 4 to 6 months postpartum. So these amazing participants came 3 times throughout pregnancy and postpartum. And almost no one drops out because women are amazing. And then we had matched controls who had never been pregnant, because the difficulty with pregnancy biomechanics research is it's hard to get people before they become pregnant
Right.
and track them.
Right.
So we use matched controls, age and pre-pregnancy BMI matched, which is maybe not the best way to do it, but was something that we could
Right.
try to kind of get some similarities. And all participants for the running part just ran across our 15-meter walkway until we got 5 to 7 successful foot strikes on the force plate.
Mm-hmm.
And we take the average of those and used that for our analyses.
Gotcha. And any kind of hiccups that came up during that process that you hadn't anticipated?
You know, not really, not beyond the typical, like hitting the force plate, having them do multiple trials.
Yeah.
But overall, it went pretty much with this population how it does with other populations.
That's good. It's always nice when that you don't have
Yeah.
any surprises. So what did the data show?
Yeah. So one thing that we saw, people ran slower during third trimester, which wasn't super surprising, but was interesting in that even though they're gaining body mass, their moments didn't significantly increase overall. So they're modulating, right? They're kind of self-correcting to maintain that more consistent joint load, I guess we could word it.
Mm-hmm.
But they did during pregnancy have some differences in kinematics, actually during and after. And the thing that was consistent at all 3 time points was they had less trunk rotation.
Yeah.
So they were kind of more stiff. They had less pelvic rotation at during pregnancy. And this, you can visually see this in some of them. I mean, the trunk, they're just not rotating and to the same degree. And during third trimester, we found what I was really interested in was like, how are the muscles around the trunk and the hips different? Because there's so many other differences, and we've seen some differences in gait. And we actually found increased activation in the erector spinae muscles. And the hip musculature was kind of complicated. So there was decreased activation, but if we control for their slower speed using statistics relative to their speed, the activation was a little higher at the muscles. So that interpretation gets a little tricky. Like they're compensating by running slower, and at that slower speed, then the demand is less, or the activation is less, I should say.
Gotcha. I think, go ahead.
Oh, I was just going to say, and then lastly, we did see in that postpartum time point, they ran with a more upright trunk in addition to that less trunk rotation, and had greater knee abduction.
Yep.
So those were kind of the big findings.
I remember when I was reading this, I was like, And I think if any, especially if you're a PT and a runner, you're reading it and you're like, yeah, of course. I mean, did you run through either of your pregnancies at all to be able to kind of make that connection to what you were studying?
Yeah, great question. I ran during my first pregnancy until about 6 or 7 months, and then started having knee pain and just went to swimming and walking.
Yeah. So when these results are coming back, like what was kind of going through your head after you'd experienced that and you're seeing this data come in? Like what's kind of coming through at this point?
Yeah. I think I was actually somewhat surprised that there weren't more differences. Actually, I mean, given like how it feels, and how it felt to me personally, and this is not everyone's, I think, experience.
Yeah.
But I actually thought we would see more differences. And I expected to see some differences second trimester, because I personally felt different even in that earlier time point. And second trimester, they looked really pretty similar, which kind of surprised me.
Yeah.
The postpartum fits with how I felt right when I tried to get back to running, and I'm sure I was.
The visual I always have with that is like a baby deer, and where you're just like, and you're trying to hold everything together for dear life, but like
Completely.
Yeah, no, definitely. No, it's interesting. Were you able to dissect out differences? You said there were some people that were runners and some people that were not. Were there any differences between in the running group, those who were used to running and those who weren't?
That is a great question. And we asked if they had a history of running, but
Mhm.
didn't get the detail that we're getting this
Ah,
time through about
okay.
like how much are you running? Are you running, during third trimester, are you running this much or
Mhm.
mileage, etc. So we can't tease that out in the way that I wish we could
Gotcha.
with
Yeah,
them.
no, I would think, and you said it sounds like you're kind of including that in something currently. Yeah.
Yeah. Yeah. So we're looking at treadmill running now. So we get, a longer time point running on
Mhm.
the or a longer, amount of data running on the treadmill. And again, we aren't recruiting specifically for runners, but we have
Mhm.
people who are and are not runners. So we'll have a
Mhm.
little more detail about that this
Yeah,
time.
and that you're gonna dive into a little bit more. Yeah.
Yeah.
I mean, it's interesting because again, I think the conventional wisdom is once you're pregnant, don't do something that you're not already doing. So I wonder if, people who are pregnant who aren't used to running, that might feel kind of super weird and awkward to do that, even just for 15 meters versus somebody who currently is doing it. I wonder if there would be differences there.
I
Um,
absolutely wonder what's been fascinating this time around because they're running a little more is a
mhm.
lot of the people that aren't runners say that felt great. Like,
Ah,
I wish I was doing, which has been super interesting. And I don't think we got the same with just overground running a short distance.
right.
Like I've had one person who's like, I'm going to start running. I'm
Oh,
like,
interesting.
okay. And
Oh,
she
that's
she
funny.
had a history of running, but just
Mhm.
thought like, now that I'm pregnant, I'm not going to.
Right. Well, I think
Um,
that I mean, that hits on a really interesting question that, we still have these societal norms where, "Oh, you're pregnant now, take it easy, just walk, go
mhm,
swimming." And for those of us that had like, I think I got to, I can't remember now. It was like 18 or 19 weeks with my
mhm,
first, had a ton of pelvic girdle pain
mhm,
and my bladder, and I was just like, "No, we're done here. This is it."
mhm.
Um, and we started, but we choose to stop versus the person that like never started because they didn't think it was safe or this or that. Like I feel like there's a lot of conversations to be had about why. Um,
Yes.
I mean, 13 years ago, I mean, I there's this tiny little part of me that wish I could have a do-over. I'm not, but like because I feel like I could fix it. Like I feel like I could do so much better knowing
Yeah,
everything that I know now that I did not know then.
yes.
But again, those women that think this is harmful, and there's so
Mhm.
many that's still being put forward of like, "Oh, the impact on your baby," or this or that, like
Yes. Yeah, the myths around this are huge.
right.
I
Um,
have also noticed differences in that, 9 years ago, 8 years ago versus now. I
mhm.
do feel like my participants, at least, have a little more knowledge
Yes.
about a lot of things related to pregnancy, which is
Yeah.
great to see.
Yeah, no, and that I feel like that's like good news, bad news about social media is where, we do get there's a lot of it's almost information overload. I'm glad I didn't I mean, we had a tiny little bit of Facebook, but it really wasn't obviously what it
Mhm.
is now. I wouldn't have wanted to deal with all the comparison and the, what should I be doing and, this and that.
Yeah.
But that's why, conversations like this I think are so incredibly important because if people are going to be accessing, social media for their guidance and medical information and outsourcing it,
Mhm.
let's get good stuff in front of them,
Yes.
rather than somebody who got pregnant and decided to make a course for 1995 or whatever. So
Totally. Yeah.
yeah. So for you, like looking at the results on that, having gone through pregnancy yourself, having been a runner for yourself, like what are kind of some of the things that you can sort of take away from why you were seeing what you were seeing?
Yeah. I mean, I think the next step is simple movement retraining. How does this feel? How does that feel? I think one of the biggest takeaways though is with a lot of things related to pregnancy, I think we don't need to be so afraid. People are pretty good at modulating some things with their running, right, to decrease load, and that is happening naturally, which is super interesting. But especially at that postpartum time point, there's a lot of kinematics that show maybe there's things that we could work on here, right? Maybe we could. I don't know. I didn't do strength testing in this group. I don't know what their strength is, but other people's research has shown, hip weakness and trunk weakness at that postpartum time point, and that makes sense. We know it's always tricky to how strength carries over to biomechanics, and if strength carries over. But I think it tells us these are things we should be paying attention to.
Right. Exactly. And when did you look at them in postpartum again?
4 to 6 months postpartum.
Okay. So they had a good amount of time. Did you have kind of any information about if they had started back to running at a certain point or done any sort of screening or readiness or things like that? Or
we don't specifically have that. The only thing we have is their IPAC scores and their amount of activity in the different categories. So we do have amount of vigorous activity that they're participating in at that time point. And I have to look back at the data for that time point. They actually didn't differ from the control group with respect to vigorous activity at any time point, which was kind of surprising and interesting.
Yeah.
But we don't have the specifics of if they were running, how much they were running at that time point.
Gotcha.
Again, we'll have hopefully this time around.
Gotcha. Yeah, no, I think that in 4 to 6 months, I think is a reasonable amount of time to be like, all right, you're doing something at this point. Whereas if you did, obviously, even just like 8 to 12 weeks, it's a total nother kind of situation as far as logistics to get an exercise. And there might be stuff going on with the infant and, all sorts of things related to birth and so on. So yeah, I think that time frame is probably reasonable enough to be like, all right, they're probably okay.
Yeah. But they're maybe not where they're going to be at a year. I mean, it'd also be super interesting to get that later time point, which we don't have with this.
Is that what are you guys thinking about pulling data at a later time to be like, hey, how are you guys doing? Or
we're doing similar time points this time. So hopefully someone else is looking at I can only ask them to come in so many times before they.
I understand, right? You're giving them like a gift certificate to get some, Cheetos or something. So.
Yeah, exactly.
Thank you, researchers. Thank you, participants. When I was it all sort of made sense because to me, to have that lack of rotation, that was the biggest one that kind of hit me. And then the hip weakness in pregnancy, to me, I was like, you just get locked down in that trunk area. There's no place to go because your kid is basically just, locking that. Your diaphragm's all shoved up. The only thing that's really moving are your little arms on your poor little trunk at that point.
Yes.
That made a lot of sense to me. And then in postpartum, you're looking for stability wherever the hell you can find it. And I think that's where that lockdown kind of continues. To me. And then I always see hip weakness on the other side. And here's the thing too, with runners, I think most runners have weaker hips anyway and don't do strength training and that kind of stuff. And then you go into postpartum and it just kind of exacerbates. And those moms that get back and don't do that added strength training, I think that potentially does set them up for injuries related to those things. Because again, you've got these issues, you're not addressing it. It's going to come back and bite you.
Yeah. And even with Gait during pregnancy, we see some decreased use of the hip, decreased work of the hip. It does seem like the trunk is trying to stabilize, the trunk is barely moving, and the hips are shutting down. And that's
To me, like in my head, it's like this big block on top of these tiny little sticks, and then the little arms are swinging, little dinosaur arms are swinging.
And I'm super interested. I also think there's some during pregnancy, the lack of trunk rotation, there's some like protective aspect of it. I even had one participant who wasn't a runner. When I asked her to start running, she had her hands on her belly. And I was like, she was literally running.
Interesting.
Like, holding the baby, not because of pain, but just
but like protective
instinct.
I think between that and boobs, it's just a whole
Yeah.
other thing
Yeah.
that you don't anticipate. And same thing with postpartum too, because usually, if you're lactating on the other end of it,
Yeah.
that bump isn't there, but the whole breast mechanics issue.
Motion and yeah.
Yeah, that's why. I mean, I would love to know your thoughts about this, kind of having dealt with biomechanics for a long time. The tendency for therapists to want to overcorrect and give cues,
Mhm.
especially therapists, maybe more in like a public health field where they don't have a lot of gait or running background, but they're
Yeah.
just taught, hey, these cues, do these, tell them to do this. Like, what are your thoughts on that?
So I think there's some really interesting research on just the trunk lean and
Hmm.
correcting that. And that seems like something that has some effect.
Hmm.
Getting too into the weeds on correcting some of the other biomechanics, I think I don't know that there's enough research to support that that's actually
Yeah.
going to long-term impact the patient.
Yeah. No, I would tend to agree. I think there's also this tendency for clinicians to that um, more complex means you have more expertise. Which as a mom, I've completely changed my outlook on that. I'm like, how little do you need to do so no one dies? Like, how simple
Mm,
can we make this? So
totally.
you just go do whatever. Um, Yeah, but I think again with the context of kind of what your paper says, like, hey, these are going to be some areas that generally are going to be things that you're going to want to target, but
Mm,
maybe not so much by the time they get running, but maybe in that prep time,
yeah,
that 4 to 6 weeks, they're starting
completely.
to move a little bit more. Let's get some more trunk mobility. They're trying to get a handle around their breasts. Work on obliques.
Yeah.
Just far more, if that area wasn't locked down. I mean, we all know how good it feels to get some trunk rotation in there when you can finally
Yes.
do it. It feels
For sure.
good.
Yeah. And that would be one I would be really interested. I feel like postpartum,
Hmm.
more trunk rotation is going to be great. I don't
Yep.
know during pregnancy
I don't know if
how
you could.
that would work or how that would impact them.
Yeah.
Um, it would
I
be interesting.
honestly, I mean, I would say with most of my pregnant women, the areas that tend to be quote tight or feel really good to have some sort of manual assist or treatment or something. Um, Mid thoracic because of the breath,
Mhm,
because that's in lockdown.
mhm.
And then paraspinals, as you mentioned, you're like those erector spinae are on because we're trying
Yes.
to correct for that, anterior weight.
Yeah.
And those poor little adductors and the outer hips are just like holding on for dear life.
Yeah.
You
Yeah.
know?
Yeah.
Like
And
I've never seen a pregnant woman that didn't want to have. They're like, oh, it feels so much better.
totally. Yes.
Because you
Yes.
can't get that trunk rotation by yourself because it's just there's a
Mhm,
baby there. There's a
mhm.
baby there. So yeah,
Exactly.
those are the ones that like clinically for me, I'm like, yeah, that's where it feels good for them. They can feel like they can get a bigger breath because
Yeah.
all of that, especially in the back,
Yeah.
is so like that. So yeah. Hmm.
Especially when they've got the baby pushing up from below. And yeah.
Yeah. No, my oldest, had his little butt shoved up my right diaphragm and rib cage for quite some time, which makes it very hard to drive stick shift on
Yeah.
that side. He's like, no,
Yeah.
we're not going to do that. We're not going to do that. So what feedback have you gotten on your paper to this point?
Um, Not a ton. I feel like most people say, okay, yeah, this kind of makes sense, especially
Mhm.
the postpartum time point. I think
Yep.
people say, okay, well, that makes sense, which is kind of like sort of gratifying, but also sort of like, oh, everyone already knew that, right? Everyone knew this. We just didn't have the the research to show it.
Yeah.
Um,
I think that's
but that's
needed though, like, especially, and I mean, this, having to deal in pelvic floor world is, you have to get that baseline out there. And even though it's not like exciting and groundbreaking, you have to have that foundation,
yeah,
in order to move forward. So thank
yeah.
you for being the person to make the foundation because we needed it. I know, we're not going to throw glitter at you and things like that, but thank you.
Thanks. But yeah, that is actually we didn't have outcome measures related to incontinence or pelvic floor dysfunction, we should ask them if they had incontinence or not in this study. So that's another thing we're hoping to have more information on. You can imagine how if you're you are leaking or you're concerned about leaking, the impact that that might have on running and the impact that running might have on that. So
Right.
that's
No, I just love the fact that we're even just asking these questions because it really wasn't that long ago that we were even doing that. It was like, all right, well, you're moving the way you are, can't help it. All right, now you're not. Let's just get running and like worry about it. And again, like I remember having conversations with clients that they wanted to go back and run and they were leaking and like having no idea on what to do with them. And I'm like, no, I get you. This shouldn't be happening, but I don't really have a great place to start. But yeah, it'd be really interesting to see like, and anecdotally again, I feel like, I don't know that I have an answer because most of my early postpartum patients, before we get them running, we want to get those obliques going. We want to get that trunk rotation going. We want to get all that stuff. But I think having a framework with some screening and stuff has made it so much easier to identify, hey, let's get these areas cleaned up because we know we're going to need them and running later on for sure. Yeah.
100%.
So when are we going to see more from you, understanding how long it takes to publish a paper?
Well, I'm hoping to actually use this same data set for the running to look. We have scores related to low back and pelvic girdle pain. So just looking within this group at those that did and did not have pain, what were their differences in running? And then also we didn't, for this, look at the spatiotemporal characteristics. So step width, step length, and cadence. So along with that, looking at pain, we're hoping to look at that in this population.
Oh, that'll be interesting.
Other ongoing study, probably be a couple years. So we still are recruiting now and trying to get, once we recruit them, we have about a 9-month delay through the, or approximately even a little bit longer until we get them postpartum. So it'll be a little longer for that.
That's the hard part about working with women in pregnancy and evaluating them postpartum is you can't make it go any faster.
Yes.
You don't want it to go any faster.
Yeah. And we could just recruit at the different time points all at once, but it is really nice to see that same person through and be able to look at that.
The data, I think, is much more rich when you can follow that person through and start to look for patterns. And at least from a clinical standpoint, I would much rather know that than have random different groups at different times, because I don't think you're going to get the same kind of type or quality of information that you would. But yeah, you got to wait till that baby's cooked.
And you're asking people to come in right at a time that's very chaotic and stressful, and so it takes a special person to do that study. So
yes, no, definitely. Well, I'm sure they're very glad to see you as a mom too, and have a face that like has been through it and understands it, and at least a little empathetic towards their scenario.
Yes,
So
yes, for
that's
sure.
good. Now, do you have kind of like students that kind of come up and start to work with you, or how does that work for those of you that are listening that are like, hey, I think I might be interested in kind of doing this?
Yeah, so I have DPT students that work with me on this, and then I have some external PhD students, but I'm more helping with their projects. But we always need people to get involved and to help, so there's always opportunities.
Yeah. For you, what made you make the shift from clinical practice to research?
I really love academia, and I really wanted to be in academia, and kind of research was the way that I was going to get there. But then I really do love the research process, and it's nice. Like, it's not a clinical visit, but there's a lot of the same aspects as being in the clinic when I'm working with them and, assessing clinical things. So I feel like you get a little bit of that world in the research world, but I've always been fascinated by biomechanics and kind of how we can interpret them and relate that to what we've seen in the clinic.
Yeah, no, and I love seeing more women in that space too, and I love that it straddles both orthopedics and kind of women's health, pelvic health, whatever we're calling it this week. Like, I love that there's, that crossover. I
Yeah.
came from ortho world myself,
Mhm.
then got put in parallel to what was then called women's health, and then realized it's just a mashup.
Yeah.
And it's so cool to see students now thinking that that's just always how it's been.
Yes.
Um,
Yes.
Not realizing that that's not always how it's been.
Yeah, for sure. And both of our projects were funded by the Academy of Orthopedic PT. So I think there's still a desire from like the
Mhm.
orthopedic side to understand more about,
Yeah,
women's health, pelvic health.
yeah. Is there more, just because I think they've been around a bit longer, is there more funding opportunities from them as opposed to Academy of Sports or Academy of Pelvic Health?
There are a couple. So I mean, a little more than pelvic health,
Mhm,
but it's a slightly larger amount. But it's now
mhm,
now it's great that there's also some pelvic health options. And
mhm.
actually, when I started looking into this, I was told, and I was interviewing for jobs. I was told like this isn't fundable. Like people don't want to research pregnancy in particular because it's 9 months, right? Which is like a very, I guess, telling attitude, right? That
Yeah,
like as if things just go back to normal and as if we don't really care
right.
about those 9 months. But I think there's been a shift in that too. And there's a recognition
Yeah,
that this matters and that we need to have better answers for
yeah.
people after pregnancy.
Well, I would think if you're just, a straight bench researcher, you're gonna wanna turn out as fast as you can, and that's a little hiccup in the whole situation
Mhm.
that you can't
Mhm.
do anything about. So, I mean, I can see that, but again, I don't know if you've read, Christine Yu's Up to Speed, where she basically goes into the history of kind of female sport and that kind of stuff, and about how hard it is or how hard it was to, A, get women in research, and
Mhm.
then, get women to be able to ask the questions that are relevant to women and get women involved in the methodology. Like, it's such a freaking hard fight. So that's why it's so important, I think, that people like you are saying, "Hey, I'm willing to wait that 9 months because we need this information, and
Mhm.
I'm happy to be the person to do it, and I'm also gonna ask for your money." So good. I'm glad I'm glad to hear that. Alright, you have a little side hustle. It is, associate, editor for the, journal. Wait,
Yeah.
please tell me the new name because I don't wanna get it wrong.
Yep, Journal of Women's and Pelvic Health Physical Therapy.
Yes, I won't ask you why it's not another name. I don't know if you know the history. My third child was, renaming the Academy of Pelvic Health to what it is now,
Oh,
which
yes,
took, 5 years.
yes.
So, I'm glad y'all came around, even though it's
Yeah,
only
so I think
partway.
hopefully it's like a good marriage of women and pelvic, right? Kept the women, but added the pelvic
All
and
good. We're not leaving women behind. I promise. I promise you then. I promise you now. Yeah. So you've been at that a couple years now. What does that entail? What do you do? And kind of what's it been like?
Yeah, so I'm an associate editor. So the associate editors work with the senior editor and the editor in chief, and do kind of the managing the reviews. So selecting reviewers, sending it out to reviewers when we get papers, and then when it comes back, you review the reviews and review the article and add anything, and then make those recommendations to the editor in chief. And it's been fantastic. The whole board there, it's just a great group of people to work with. But it's also super exciting because I feel like the journal has made a lot of great progress, even before I joined. So it's just exciting to see the momentum in this area. That's a very specific area to people who want to know like this little niche, right?
Yep.
This very specific thing where there aren't always resources that are very clinically applicable, but also present the research in this area. So it's been really fantastic.
Yeah, we were super happy with all the running stuff last year with Shefali
Yeah,
and her crew. Because I want to know, where are we on indexing?
that is the number one goal. So that is in
First of
process.
all, explain what that is, because the average person doesn't know the differences between different types of journals and what indexing actually is.
Yeah. So once you're indexed, you the goal would be to be indexed and be available in PubMed, and you receive an impact factor too. So this is important for people who are going through the rank and tenure process. A lot of times need to report things like an impact factor and show that they're in an indexed journal. So if a journal isn't indexed, people may submit somewhere else. So for this process, we're actually at the point where we have all of our ducks in a line with the journal, and we have made a bunch of changes and have kind of looked through what are the specific requirements to be indexed, and are at the point where after you have to show a sustained time period where you're meeting the number of articles that need to be published, all these other details that I think that the general public wouldn't maybe know about, but you have to meet all these benchmarks. And then once you do that, you apply for being indexed. So we have all our ducks in a row, and we're going through that time period of continuing to check off those boxes.
What are some of the other things that because I've been out of it for a little bit. What are some of the other things that the journal has done to kind of meet the criteria? What changes?
Yeah, great. So part of it is having people involved on the board who have international recognition. So you have to have kind of a certain stature, right? You have to have the right number of pages, which going to online helped us have the number of pages to have the necessary number of articles, and things like case reports don't count for that. So one of the things you have to pay attention to is kind of the quality and the level of evidence that you're publishing also, to be able to meet that benchmark. Then there's other things that are much more editorial, kind of making sure that you consistently follow the format. There aren't differences in format from journal to journal. Everything's listed correctly on the website, those types of things.
Gotcha.
Information for authors being very specific was one of the things that we've worked on. So it's a very streamlined process, so authors can follow exactly what is needed to get this boost.
And just for reference, you're talking about the journal board, not the board of the academy. They're separate.
The journal for the journal, yeah, exactly.
Right.
Yeah.
So right now you guys are just in kind of turning it out and getting stable at this point.
Exactly. And hoping within the next 1 to 2 years that application can go in and
we will cross
all. Yes.
Because I feel like the entire time I was on the board, that was always like the thing. Like, we need to get this, because it matters.
It does matter.
It matters. In who sees the work, and then also who submits to your journal. You're going to have much more people of higher caliber be like, hey, you're indexed. I want to submit to you. You want to be that journal of choice.
Yes. I think the very specific people who are really active in the section and are great researchers will still submit to the journal, because it's like, they have that affinity to it. Right. But you're not going to pull in the same outside authors without that. So it is the focus right now.
Yes. No, and I think if you're an academy historian, if you go back and kind of look at that evolution, it's been very conscious and very it's been a shift, which again, if we're going to move all this stuff forward, we need to get a lot of different voices at the table. We need to have that diversity. All that stuff is good. So best of luck on that.
Thank you. Hopefully there'll be good news in the near future.
I hope this for you. I know that it's probably like you having your third child at this point.
Well, it's luckily Cindy, the editor-in-chief, she's really taken the lead on that.
Yeah, no, she had shifted over into editor, I think, on my tenure. So we were very happy that that was something that she wanted to do, and very much excited for it to happen. So
Yeah, absolutely.
cool. All right. At the end of every episode, we ask our guests a couple of different questions. So we're going to start with either a book you're reading or a podcast that you're listening to right now.
I just started reading, actually, this is kind of relevant, I guess, a book called Motherload,
Ooh,
which is actually about like the mental load that moms carry. So maybe relevant to this podcast. But I'm only a few pages in, but it talks about the like actual structural changes in the brain, and then how
oh,
that relates to also just the massive amounts of things that moms carry on a
gotcha.
daily basis mentally.
Is it more of a heavy read or is it a pool read?
It's light. It's
Okay.
she was a journalist, so it's
Okay.
like snippets, and it's written in a way that's pretty easy, which is
Okay,
what I
good.
like few pages before bed.
Okay, good. No, I don't know about you, but I go back and forth. Like I'm sometimes like all into like work reading stuff, and then I just need like total brainless pool read.
Yes.
Like
Yes. Totally.
I need to be entertained, especially if I'm going to keep my eyes open. So okay. Favorite activity since becoming a mom?
Oh, favorite or one I do the most?
Whichever, and or both.
Spend time at my son's soccer practices.
Oh
That's
gosh,
not
yes.
my favorite. That's what I do the most. Favorite activities since becoming. Well, one thing that's, I guess, relevant here, I don't know if it's my favorite. Lately, I've been running with my kids, which is
Oh,
incredibly fun, and
cool.
they love it. And my son leaves us in the dust, but that's been really fun.
They do that. My oldest is not the athlete. My daughter, I think she's coming around on running. They used to have a great like one night a week, there was like a girls running program that some of the teachers did. And
Yeah.
unfortunately this year it just didn't happen. And my daughter won her school's like 1 mile run last year, but this year she wants to do the 5K. And I was like, okay, if you don't have your girls workout program, like we're gonna have to do some work here, girl.
Yeah.
So
Yeah.
that's fun when they choose to, when they want to run with us. That's
Yes.
super cool.
Yeah.
All right. One piece of advice for new moms.
Give yourself a little grace. Don't be
Everyone
so
says that. I love it.
I mean, we've all been through it, and we're all like, you can never live up to the expectations that
Yeah.
it's more, I mean, society, but also you, right? Set for yourself. Like, don't be so stressed about
That's good.
all the little things.
And then work on your trunk rotation and your hip strength.
And don't forget.
Yeah, exactly. We'll tailor that one for you. Okay. Who's somebody, it can even be in like running, walking space, biomechanics, whatever. Who's somebody in kind of pregnancy, postpartum, or that other space that we should know about?
Well, I personally am really interested to see some, I know she's been on here, but I'm interested to see some of Shefali Christopher's upcoming research, because she'll have the complement to what I'm doing, which is like general people who are running, but she'll have the very specific runner biomechanics data, which I'm super interested to.
Yes. She's been on before, and then actually we're going to catch up next week.
Oh, perfect.
Yeah. So she's always one where I'm like, all right, it's been too long, Shefali. We need to get back and chat again. So
So I'm really interested to see what they find.
Yeah. No, and for her too. I remember I actually found out about Shefali a couple of years ago from a colleague of mine that was very active in Sports Academy. And I think it's so interesting that was kind of my understanding of her foray in was like to go through sports first and then come on over to pelvic, which I'm glad it happened, but it's a shame that that's, the way that like we should be starting with us first.
But. Yeah. Come to pelvic.
Yeah, exactly. Exactly. Come to us. We're better. Anyway. All right. And then last one here. What does it mean to you to be an active mom in postpartum?
I think this to me is just to be able to get back to what's important to you, right? Yeah. There are some minimums I guess, recommended to meet, but just to be able to do the things that are important.
Yeah, totally. And sometimes you don't even know what those things are. They could be soccer games.
Yes. entertaining your daughter on the sidelines of your
Oh,
school.
right. Yeah, you have that. Yeah. No, what's fun is when they both have games at the same time on completely different sides of the county, and then you realize how fast you can drive. Um, awesome.
Exactly.
All right. If you want to know more about Jenny's research, you can find her over on X, Jenny Bagwell PT, or Instagram, Jenny Bagwell PT. You got to put more over on Instagram. I know all the
I
researchers put
know.
stuff on X, which is where I find you all. But it's mean over there.
I know. Well,
It's not cute either.
I
It's
know. And I'm not, and it's even from I should be better on social media in general. I don't post on X
I'm
much.
here
I'm
for you.
very
But that's actually one of the reasons that I did the podcast is because um that's the thing. You guys are really good at doing your research and
really bad at social media.
well, you're actually really easy. There's some researchers that come on. I'm like, you're a person too, and they think they're like going to tell me verbatim their research. I'm like, no, 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 no. Like, I want to hear the story behind it. Like, I want to like, and they're
Yeah.
really funny, like smart people, and we need to make research accessible to people.
Yes.
So that was part of my reasoning on making sure that we did have researchers come on the podcast. I'm like, you're people too, and you do some great work that people should really know about. But yeah, we need to get your X's.
Be better.
Jenny Bagwell, thank you for being on the podcast. Thank you for studying all the things you study. Keep doing it, please. And if you ever have studies that you are recruiting for, please let me know. I'm happy to spew out through my channels as much as possible. Because again, the more women we can get participating, the more people we can inspire by stories like yours, where we can inspire other PTs or whoever to go into research. The more this gets moved forward. So thank you.
Thank you. Yeah, any LA or Orange County people right now, if you're pregnant or postpartum, let me know.
Okay, that's good because I have a couple friends who are clinicians in that area, so I am going to let them know ASAP.
Thank you so much. It was great to talk with you.
Thanks. Did you enjoy the podcast? If so, leave us a 5-star review on iTunes and tell a friend to do the same. Register now for the free on-demand Postpartum Mama Masterclass, How to Overcome the 3 Most Common Return to Run Mistakes. You can skip to the good part and get back to running while missing these mistakes. Find this and more free resources under the patient section on carriepagliano.com. This podcast represents the opinions of Dr. Carrie Pagliano and her guests to the show. The content should not be taken as medical advice and is for entertainment purposes only. Always consult your healthcare professional for any medical questions.